Hello, I am Dr. Harsha Reddy. I am consultant obstetrics and gynecology. I practice in Cloudnine Hospital, Sarjapur branch and the Bangalore branch in Bangalore. Hysteroscopy. In hysteroscopy, we use an instrument which is thin, long, lighted telescope. It is introduced through the cervix into the uterus. This is a minimally invasive procedure which your doctor uses to visualize the interior of your uterus as well as of the cervix. So there are different kinds of hysteroscopes. An hysteroscope can also be done in the clinic or in the OPD, or we call it as an office hysteroscope. These are flexible hysteroscopes and less than 4 mm in diameter, which can be done with either without any sedation or under local anesthesia as well. The doctor is able to diagnose what problem is there inside the uterus, any intrauterine pathology, and probably even treat it without taking you to the operating room. Now, the other method of hysteroscope where we use a very stiff kind of the telescope can be for diagnostic processes or for therapeutic procedures. In these instances, usually general anesthesia is going to be given. So what is the preparation for hysteroscopy? Your doctor may ask a few investigations, blood investigations which you need to do. A test may be done to make sure that you are not pregnant. The procedure is usually going to be scheduled at a time when you don't have your periods. You may be asked to stop a few medications such as blood thinners, that is aspirin. You will be told to continue certain medications which you may be taking for high BP or if you have a thyroid problem. If during examination the doctor has found that the cervix, that is the mouth of the uterus through which the hysteroscope first has to pass, is the hole, the opening looks as a very tiny hole which we call as a pinhole, or if any treatment is going to be planned along, that is a therapeutic hysteroscopy is planned, you may be given a medicine which you may have to take 4 hours before the procedure, and this is basically to soften the cervix and to help to dilate the cervix easily during the procedure. If it is going to be done under general anesthesia, you will be advised not to eat or drink anything, that is to remain fasting for at least 6 hours before the procedure. You are advised not to use any vaginal medication, douches, or avoid intercourse at least 24 hours before the procedure. Now coming to what is the care following the hysteroscopy. If it is done under general anesthesia, depending on the duration the procedure lasted, you will be allowed to drink some water at least 2 hours or 4 hours after the procedure. If you are tolerating oral fluids, you will be allowed to have your soft diet, and following that you can have a normal diet. So there is no specific restriction of food of what you have to avoid after a hysteroscopy. Usually you get back to your normal diet by the end of the day or the next day. You can even get back to your normal activities by the next day. Certain medicines will be given to you if you are going to be having cramps to relieve the pain. Sometimes antibiotics may also be prescribed to you. You may continue to have a minimal bleeding which is called as spotting. If the bleeding is more than the spotting, it is better that you get back to your doctor, and you are usually advised to avoid intercourse for at least 1 week.